Hello and welcome to today's webinar. We'll be beginning in just a few moments. For all of those people just now joining us, we'll be beginning in just a few minutes. Hello, everyone, and welcome. We will be beginning in just a few moments. We're waiting for everybody to hop on. Hello and welcome to our Impact Program webinar. Today's presentation is Family Medical History, What and Who is Important. I am today's moderator, Jillian Sotelo. During the presentation, we encourage you to use the chat box to engage with other attendees and panelists. Anything written in the chat box will have your name associated with it. All questions should be asked in the Q&A box on the top bar of your screen, which may be submitted anonymously or with your name attached. Questions will be answered at the end of the presentation. As a reminder, we are recording this event to be made available in the next few days on the Impact Program Cancer Care CSC site. Julie Goldstein, one of our Impact Program navigators, will be discussing today's topic with additional information about our program from our Impact Program leader, Kelly Nickelbein. Julie, thank you so much for joining us today.
Hello, everyone. As Jillian said, welcome. Thank you for joining us. I know this is a really busy time of year trying to wrap work up before the new year, so I appreciate such great participation. As Jillian said, today we'll be discussing the importance of collecting family health history information. We figured this was a good time to bring this up as the holiday season is in full swing. For better or worse, this is often a time when people get together with family members. So a really good reminder of what you might want to discuss with family members if you're with them this holiday season. So, what do we mean when we talk about what is a family health history? So, really, this is just a fancy way of saying a record of a person's family relationships as well as medical history that includes current and past illnesses and family members. The reason that this is important is because as we're learning, many different health conditions, including cancer, but as well as other conditions, can have a hereditary component. So certainly knowing if other family members have had specific medical conditions, we can get information about what that might mean for your health. Is there anything potentially running through the family causing a higher risk for certain conditions that could have an impact on your health? Learning this information is really important because it enables you to work with your physicians to take steps to keep healthy. A physician, based on your family history, might recommend different screening options, prevention options, or recommend risk lowering behaviors that you might not have known to take unless we knew about your family history. So the question is, well, what kind of information do I need to know? It does sometimes seem like a daunting task to collect information about family history. So I wanted to focus with you on the questions that you should be asking that would be most helpful for you to gain a full picture of the medical history in your family. First, it's important to know family members' current ages. For those who have passed away, it's important to know the age at which they passed away. It's also important to know what their cause of death was. And any medical conditions anybody in the family might have had is important. So remember when you ask about somebody's cause of death, that might not always be encompassing what other medical conditions they've had. So, for example, you might find out that your grandmother passed away of a heart attack at age 80, but that she had breast cancer at age 60. So, not only is their cause of death important, but also it's important to know if they had any other conditions during their lifetime. If you do find out that family members had medical conditions, it's important to ask at what age did they start having these problems? I really like to emphasize that you don't need to get very caught up on the specific age because I will sometimes have patients him and ha with me of, I don't know if my grandmother was 57 or 60 when she developed breast cancer, and that's okay. It's important to realize that you don't need to know everything to, the exact T, but just to have a general idea. So what's important is to know, is this a problem that they developed in childhood? Is this something that they developed in their 20s versus something they developed in their 50s or 60s? So even narrowing it down to decade in life of development of the disease or part of life, meaning early adulthood, mid adulthood, that's even helpful information. It's also helpful if you can to get information on what type of treatment they might have had for their medical condition. A lot of times you might have a family member say, well, I know that Aunt Sally had some sort of condition. I don't know what it was, but I know that she was treated with insulin. So even though that person might not put it together that Aunt Sally had diabetes, knowing that Aunt Sally was treated with insulin might give us the clue to kind of put the pieces together that she had diabetes. And a lot of times, if you take that type of information to a healthcare provider, they're really good at sort of tracing back what condition a person might have had based on the treatment that they underwent. Also important nowadays, even more so than ever, is finding out if family members had genetic testing. So if there are concerns that something's running through the family, might be good to ask, do you know if anybody in the family had genetic testing for this condition? Is this something that we have access to that we could get more information about? Really good questions to ask there. Also important to focus on ancestry. most of us who are in the United States had family who came from somewhere else to the United States. So ancestry really means where did our ancestors come from before here? So, are they English, Irish, German, French, Italian? This is key information because we know that some ethnic backgrounds are at higher risk for certain genetic conditions. So, I think just from a historical standpoint, it's pretty cool to know information about where your family came from. But from a medical standpoint, it can be helpful again because we know that certain ethnic backgrounds are at higher risk for certain medical conditions that can run in families. So we just talked a lot about the type of information that's important to get. It might seem like a daunting task to get this information from family members. So I just wanted to review a little bit about how to even get started with getting this type of information. The first step, although it might seem silly or kind of intuitive, is really just to make a list of all of your blood relatives. I don't have a particularly large family, but I've worked with people before who might have 10 siblings or might have 12 aunts or uncles. So writing all of those people down almost as a checklist of people you need to go through to get information about can really be helpful. The key people, a lot of times people ask me this question too. Well, how far back do I need to go? What family members are important? Certainly your children, brothers and sisters, parents, grandparents, aunts and uncles, cousins and nephews. So sort of your closer family members are a great way to start. Remember, every family structured differently, so not everybody will have children or siblings or aunts or uncles, but that's the general framework to work with. And again, just keeping a list of those people so that you know who you need to ask questions about. I always say do not discount the older generations in the family. Grandma, that Aunt Sally we were talking about before, they tend to be really knowledgeable about the family history. They've been around for a long time. They've seen the generations grow and develop. And I guess, as my kids would say, they know the tea. They know what's going on in the family. So if you or your mother doesn't know the information about a particular family member, it's always helpful to ask people in the older generations. I laugh because there's always one family member. I've noticed this with almost every patient I've seen. Every family has one family member who, for some reason, is just very interested in the family tree. So finding out who that person is can be invaluable in getting the information that you need. And again, if you don't know information about a family member, ask around until you can find somebody. And even just starting with who's passed away, what age did they pass away, and what was their cause of death can at least start the conversation to get you on your way to the information that you know. For those of you who may have been adopted, your question might be, well, I don't have anybody to ask. I'm not aware of my biological family history. Is there anything I can do? And I have listed here, which we'll go through, some resources for people who are adopted if they are interested in obtaining this information. So when we talk later about looking at a family tree or even doing genetic testing, I want to make it clear that you don't have to have this family history information. Some people don't have that information. And, that would never be a reason for us or a medical professional to turn somebody away from undergoing genetic testing. Um, Sometimes we're just a little more limited and what we can say when we don't have the family history information. And, obtaining family history information for somebody who's adopted can go beyond just getting medical information. So it might not be something that somebody's interested in. Now, having said that, if somebody is adopted and interested in obtaining more information, there are certain places you can go to try to obtain that. First would be, depending on the state you're in, requesting adoption records from the adoption agency or from the state vital records office. We put an asterisk here with a website that has information for state by state of how you could possibly obtain adoption information if you're interested. Um, you can always ask your adoptive family if they have the information. Often, genealogical and historical societies keep pretty immaculate records on births and deaths and other events where they might also keep information about adoptions. Same with orphanages and maternity homes. They might keep information about babies who were born and their parents' names and information. Again, going along with those genealogical and historical societies, we often see churches that also kept pretty immaculate records of members and births, and some again might record adoption information. US Census records are also a place to look. Lastly, I wanted to focus on DNA testing services, which some of you might be familiar with, that could either link you to other relatives that you didn't know existed or give you some basic information about your ancestry. Because at-home genetic testing or direct-to-consumer testing has become a hot topic and has become a lot more popular these days. I wanted to spend some more time talking about that. I know this is going a little off topic, but if somebody is interested in using these testing services to get more information about their family, I think there are some considerations to go into. So we'll talk about that for a minute before we get back to talking about using family history information to assess disease risk. If anybody's heard of at-home or direct-to-consumer genetic testing, you know that these are genetic tests that don't require an order from a physician or any other health professional. So that means these are kits that you can buy at a drugstore, online, over the phone. Typically, you get a kit sent to you, then you mail usually a saliva sample back to the lab for a particular type of testing. There are many different companies out there with many different tests available and options. So depending on the test and the lab, things that might be tested for would include ancestry. So even people who know a lot about their family history might just be interested in finding out more information about specifically what countries they came from. Sometimes these lab tests do offer information about wellness or risks for certain diseases based on your genetic profile. Sometimes for common diseases like diabetes, heart disease, cancer. Some of these tests might even give you information about whether or not you're a carrier for a specific genetic disease. Some might also give you paternity information. So if there's uncertainty about a person's father, that can sometimes be assessed through this type of testing. But it's important to remember there are caveats to this testing. So it does sound like great, the world is my oyster through doing this type of genetic testing. I just like to remind people of some caveats when assessing whether or not this type of testing is appropriate for them. First and foremost, if you are using this information to obtain health information, specifically your risk for heart disease or cancer, remember that this testing is typically more limited than the clinical testing ordered in a professional setting. And it's also not made or ordered just for you with your risk factors and your personal information in mind. So these are general tests that are given to anybody who would order them versus a test that is handpicked by your physician based on your personal characteristics. These tests also might not include all of the information you are hoping to find. So, what I find to be something to really dig into when you do this testing is you might not even know that the tests don't include all the information that you're hoping to find. So a really good example is there was, I'm not sure if it's even still on the market, a test on the market that advertised that they do genetic testing for breast cancer risk. However, they were actually doing testing for breast cancer risk just for 3 specific mutations that occur in only 2 genes. So people were under the impression that that was coming back negative, that they weren't at high risk for breast cancer, when actually the test just was not all inclusive of, again, what would happen if you had that ordered in a professional setting. Or it might be that you order these testing thinking that you're going to get a risk profile for every single disease under the sun, and that's not the information that you get back. So something to look into before you have the testing. The other thing to consider is when you order this type of testing and send the kit back to the laboratory, they actually have access to your DNA, which could introduce different privacy issues compared to testing ordered in a healthcare setting in a clinical healthcare laboratory. So there can be concerns about how your data is protected, how it is shared, and how it is used by the company. And oftentimes, people do this type of testing to avoid working with a healthcare professional when it turns out that based on the results you get from the testing, you might require follow-up with a genetic counselor or a physician to review your results anyway. Again, things to think about. So before you order an at-home genetic test, remember to look into, is the company trustworthy? Meaning, does the lab have, you can look to see if the lab has certain certifications from agencies that typically oversee lab quality and standards, kind of like the FDA, but focused on laboratories. Also, does this laboratory employ staff members with knowledge and what this testing is looking for? So are there people on staff like medical geneticists, genetic counselors, molecular pathologists, people who are very familiar with the data that the laboratory is generating? Again, we talked about this on the last slide, making sure before you go into the testing, you know what type of information you're getting from the testing, so there aren't any surprises with you either not getting as much information as you were hoping to get or getting more information than you bargained for. I think classic example of that is, people finding out that maybe their father's not their father, or that they have half siblings that they were linked to that they were never aware of. Situations like that can come out of this type of testing. Also, as I mentioned, make sure that you have a good understanding of how your personal information will be protected. Often in the fine print, you can review each company's privacy and security policy. So good to look into that before you commit to giving your DNA to one of these companies. Lastly, as we had talked about, what professional help will the company provide if you need guidance after getting the results? So is a genetic counselor available if my results are confusing? Is this provided free as part of the testing fee, or is this something that I would have to pay for on top of it? If there is not a genetic counselor that works with them, would they be able to locate one, help refer me to somebody who can help me with that information? So I know that was a long aside, but again, because people are using these at-home genetic testing companies to help them get a better understanding of their family history, I thought we would be remiss if we didn't put that in there. So now we're going to turn back and go back to talking about what we do with family history information once we get it. So typically after a person obtains family history information, if they come to see me as a genetic counselor, what I do with that information is draw out what's called a pedigree. So a pedigree is a fancy way of saying a family tree using established symbols, and it's used to review a person's family history. It gives you more of a visual look for patterns that might suggest a risk for genetic disorders or health-related conditions in a family. So it's basically, instead of just a list of your family members, kind of draws it out in a diagram where you can see how people are related to each other. I always laugh because now I don't know about Kelly and Jillian, who are also genetic counselors, but anytime I'm even talking to a friend and they're talking to me about, well, my cousin's children or my aunt's brother, I'm always constructing the pedigree in my head. That's just what I do now. When I hear people talk about family, I can't follow the story unless I have the pedigree all drawn out in my head. Um, so a pedigree is a very standard way of drawing out the family history. There are standard pedigree symbols that all medical professionals use, so that it doesn't matter what language you speak, what country you're from, we can all communicate with each other about somebody's family history just by looking at the pedigree. So typically there are squares used for males, circles used for females. There are also standard symbols for people of who identify as non-binary or gender diverse. There are also different abbreviations we use for people who identify with a different gender than what they were assigned at birth. You can see under each symbol, it says an age. So the 56Y means 56 years. So we basically, want to keep track of that person's age and their gender. You can see at the bottom in the oval that we have, when we draw out a family history, there are lines across that says sibship line. So that means that those four people are siblings of each other. So a line across indicates a sibship, a line up indicates a line of descent, or meaning a parent line. So the square and the circle above those four individuals are those people's parents. And that's pretty much it. Again, when we draw this out on a larger scale, gives us a better idea of any patterns that we might see in the family. And as we go on, I'll show you a sample pedigree to show you how it can be helpful in looking for patterns of disease in a family. As you know, anybody who's been part of one of our webinars before, we are the IMPACT program. So we do focus on cancer and cancer family history. So I wanted to remind everybody today, when you do get family history information, one of the things that you can do is look for features that might be concerning for inherited cancer in the family. Most of the time, cancer does not run in families and is not caused by gene changes being passed down through the family. About 5 to 10% of the time it is. So when you gather your family history information, be aware of certain features that might suggest cancers running through your family. First is if we see more than one person and more than one generation with the same type or related type of cancer. If we see cancer diagnosed at a younger age than expected for that type of cancer. So remember, the age at which a patient is diagnosed with cancer is important, but what's more important is to know whether or not that's a typical age for that cancer. So for example, if somebody told me that they had a family member who developed thyroid cancer in their 30s, I would think, well, that's not an unusual age for somebody to develop thyroid cancer. However, if they told me that a family member had breast cancer in their 30s, that would be concerning to me because that's a much younger age than expected for that type of cancer. If we see a family member who's had more than one cancer in their lifetime, so maybe somebody who had breast cancer at one point and then later developed an ovarian cancer, that can be concerning. Or even a family member with a rare type of cancer, particularly when that's combined with these other features that we had just talked about. Um, I had also mentioned ancestry when we were talking about the important information to gather. I had mentioned that some some ethnic groups do have a higher chance of genetic predisposition to disease. When we talk about cancer risk, people of Ashkenazi Jewish ancestry are the main group that raises concern. So Ashkenazi means Jewish ancestry from Central or Eastern Europe. So German, Polish, Russian. People with that type of ancestry do have a higher chance of having an inherited form of cancer in their family. So if you know that you have Ashkenazi Jewish ancestry and any of these risk factors, that could be even more concerning for inherited form of cancer in the family. So, as I promised, I was going to put up a full pedigree. Um, Two caveats. Number one, I completely made up this family. So, if, like they say at the beginning of movies, any resemblance to your family or real people is a coincidence. And I did try to make it pretty obvious so that you could see what I mean by family history features suggesting cancer risk running through the family. When we draw a pedigree, a couple things I didn't mention when we were reviewing the pedigree symbols. First, anybody who has a diagonal line means that they've passed away. You can also see that's indicated by a D under them with an age, so that indicates the age at which they passed away. The person with the arrow pointing to her is the first person to come to medical attention. In this case, we have Alpha Bathrop. I had to throw that in as a nod to Wicked, if anybody has seen it. And I keep thinking that if my 13-year-old daughter was on this call right now, she would probably call me cringe for putting that in there. But just thought it was funny to throw in a little bit of a holiday movie since we're talking about holiday time and family history. So you can see in this pedigree on Alphaba's mother side of the family, her mother is 60, she's alive and well. Mom had one brother who passed away of lung cancer. He had a history of smoking. Mom's father had prostate cancer, but that was not the cause of his death. He ended up passing away from a heart attack many years later. But when we look on Alphaba's father's side of the family, we do see some patterns here that can be concerning for inherited cancer. First, we see that her father had pancreatic cancer. In addition to that, we see that there's breast cancer in an aunt. So the sister of Alpha's father passed away at age 40 of an early onset breast cancer. And there is also a cousin to Alphaba, so the child of her uncle, who is 35 and looks like was recently diagnosed with breast cancer. And then we also see ovarian cancer in a grandmother on the father's side of the family. The other thing to note is that everybody who's had a cancer diagnosis is colored in with a different color. And again, that's a way for us to get a fast, quick visual understanding of the pattern of disease in the family. So obviously, the more people you have colored in with the same color would give you the idea that multiple people in the family have had the same type of cancer. Kelly will be on, coming on in a minute to talk to you more about the impact program and how you can use our resource if you do have any of these concerns of cancer in your family that we just discussed, or if your family history looks similar to Alphaba's. Before she gets on, though, I just wanted to let you all know of what I think is a great resource called the My Family Portrait. It's put out by the CDC, the Center for Disease Control, and it basically allows you to enter your family history information, and it saves that information for you, so that you can kind of keep it as a running list. So maybe on Thanksgiving, you were with your mom's side of the family and you were able to get some information, and maybe on New Year's Eve, you're going to be with your dad's side of the family, so you can get their information and put it all together. It does also allow you to print the information to share it with your healthcare provider as well as any other family members. I have the link down there too, if anybody wants to take a picture or copy that down. Again, this is a great resource to keep track of your family history. And I will stop talking and turn it over to Kelly.
Great, thank you. And I just want to note that Jillian just put the link in the chat. So if you're interested in using this resource, please check the chat and you can find it from there. If you could move to the next slide. Yep. Okay. Thank you. So as Jillian mentioned in the beginning, I'm Kelly Nickelbein and I lead our Impact program. It is a support program for our employees and their family members that have a cancer diagnosis, but we also work with a lot of individuals that may have a concern about their risk for cancer based on family history. So these are folks that don't have a cancer diagnosis, but would like to learn more about their family history and potentially discuss and undergo genetic testing. I've seen a lot of really great questions in the chat, and so I don't want to take up too much time, but I will say if anyone is on the call that isn't comfortable with asking very specific questions in the chat and would like to reach out to us individually for the Impact program, I'll give you that information on how to reach us, and we can enroll you in the program and talk more specifically about your family history. So back to the Impact program. As I said, we support colleagues and their dependents that are on a medical plan through Thermo Fisher Scientific. So that would be the national plan, United Healthcare, or any of the local plans like UPMC or Kaiser. It is free to join and enroll, and our services are all free as well. So essentially what would happen is if you enroll, you're connected with one of the navigators, which is one of the three of us, and we are all genetic counselors by training. We are the single point of contact for especially the individuals that are going through a cancer diagnosis. We help to coordinate all of the different services that might impact someone with cancer. So whether that be coordinating the virtual second opinion, or navigating internal Thermo Fisher benefits like health insurance or leave information. There are a lot of internal benefits that we have that could be useful. As I mentioned, because we are genetic counselors, we can provide genetic counseling about cancer risk, and we also help with identifying any additional resources that someone might need that would be helpful. All right, next slide. I already mentioned who qualifies, really anyone who's on a medical plan through Thermo Fisher. And like I said, that could be the employee themselves, a spouse or dependent, or children. I will say just a brief note that if you are not on a Thermo Fisher health plan, because I know a number of employees choose not to be or are on a partner's plan. If you still have questions or you're going through a cancer diagnosis, please reach out. Sometimes just we can discuss the situation on a colleague-to-colleague basis and share some of our external resources or any resources and benefits that still may be applicable for you sort of outside of the Impact program. So please don't hesitate to reach out if you're in that situation. Okay, next slide. And then I mentioned enrolling. It's fairly simple. So all you would need to do is email us at impact@thermofisher.com. So this is our general email. It just comes to the three of us, myself, Julie, and Jillian. Once we receive that email, and the only thing you need to provide is your name and an email address. So if you're emailing us, we'll have the email address, but your name and that you're interested in enrolling. You don't have to give us any other information if you don't want to at that point in time. Once I have that, then what happens is I will send you an electronic version of our enrollment or consent form. You'll sign that digitally, and then I will be in touch with the next steps for scheduling your introduction call with your navigator that I'll assign. So fairly simple. I will say that typically after a webinar like this, we have a number of requests for enrollment, which we absolutely love and encourage. Just give me a day or two to get back to you. If it seems like it's been more than 2 days and I haven't responded, I'm human. I try not to miss anyone, but if that seems to be the case, please reach out again. It would be a complete oversight. Like I said, it doesn't happen often, but if that happens, please let me know. All right, next slide. Okay, so for additional resources, I think Jillian mentioned in the beginning that we do have a site on the Colleagues Service Center site, and you can just search Impact or Impact Program. If you have any trouble finding it, just let us know. We also have additional information that we can send out whenever you email us at our email address. Also, information is available on My Benefits. I will say that also the Colleagues Service Center site, it looks like Jillian is putting it into the chat, will house most of our webinars from the past. So feel free to take a look at, we have a lot of different topics on cancer genetics and specific cancers. So you can feel free to take a look and watch those from there. All right. So with that, I'm going to wrap up and open it for questions. I know like I said, there have been a number in the Q&A. Jillian will moderate them. If we don't get to your question, or if you want to reach out to us, email us at impact@thermofisher.com, or if you want to reach us individually, our emails are on this slide. All right, Jillian, take it away.
All right, guys, thank you so much for putting this together. We do have some great questions. The first one that I thought was a great question is, how far back do you have to go when you're asking your family history? How many generations would we typically recommend?
That's a great question. I typically recommend at least going back to your grandparents. It can sometimes be difficult to get information beyond that. If your grandparents are still living and can provide you with information about their brothers and sisters and their parents, that's great. But going back to your grandparents, and then, your children, nieces, and nephews generation is usually pretty thorough.
Great. Can the genetic testing results be used by health insurance companies to deny coverage?
So that means you're talking about if you have genetic testing through a healthcare facility with a healthcare provider. I'm assuming that's what you mean. That is a great question. So there are, and I could probably spend an entire webinar talking about this. There is a national law called GINA, Genetic Information Non-Discrimination Act. And there's also something called HIPAA, which you are all familiar with because every time you go to a doctor's office, you have to sign a HIPAA release. So the short answer to that is under GINA and HIPAA, there are protections for health insurance discrimination if you're in a large group plan, meaning that an insurance company through your employer can't charge you a higher rate, can't drop you from the plan, can't give you different coverage versus somebody else based on genetic testing results. GINA also covers the same thought with employment. So you can't be fired from a job or not hired or compensated differently based on your genetic testing results. So that's the general answer to that. If you want more information about that, I can certainly provide you with some websites of good places to go to get specific information. Some states also have their own laws as well.
And Julie, just so you know, I just dropped in the chat a link to the National Society of Genetic Counselors information about GINA. Their
That's
brochure.
where I was going to send them. So perfect. Thank you, Jillian.
Absolutely.
Yeah.
And the person did follow up with a question, not just clinical testing, but also independent genetic testing like 23andMe. The GINA law applies to all genetic testing for medical conditions. So I don't know if there's, I think that probably answers that question. And also the non-protection for long-term care insurance, long-term disability, and life insurance also applies to all genetic information, not just cancer genetics or genetic information obtained in a clinical setting.
Right. But it's
Um,
also really important. Another reason to really read the privacy and security policies
mhm.
if you're doing testing through a private company, because not all of the information that you obtain from this is health information.
Mhm.
So just important to keep that in mind when looking at those direct to consumer tests.
Another question came in about, I'm thinking the question is asking for a family history where there is some information that's really not known,
Mhm.
or maybe has a lot of different things that pop up in the family history. Would that be a stronger recommendation for a genetic test?
It really just depends on your concern and your, personal preference for getting information. Um, I would say that, if you're really unsure of your family history, doing genetic testing might be helpful in discovering your health risks. But it's really would require a discussion of sort of what your expectations are, what you're hoping to find, sort of the caveats of doing genetic testing on somebody without family history information. As far as somebody with multiple concerns coming up, meeting with a genetics professional to determine whether or not these concerns are something that could impact your health would be important. Sometimes, people do have a lot of concern about their family tree, and we are able as genetic counselors to put them at ease a little bit and talk about the features of a family that might be concerning for an inherited condition that actually isn't going on in their family. So, it just really depends on what those features are and working with a genetics professional to help you to decide whether or not testing is appropriate and how that could be helpful for you.
Okay, great. Another question came up, is genetic testing covered by insurance?
So it depends on what you're having genetic testing for, um, what insurance you have, and what criteria you might meet. So some insurance companies, and again, genetic testing, when we're talking about genetic testing, that can mean anything from a test when you're pregnant to a test for cancer risk to a test for a child who is born with developmental problems and the pediatrician is seeking a diagnosis of a genetic condition. So that's, a very broad term. So it really depends on what you're testing for, what your insurance company is, and what their standards are as far as things that they will cover.
And Kelly, there's a question in here. Can you indicate the requirements to enroll in the impact program?
Yep, absolutely. So the only requirement to enroll is that you are on a Thermo Fisher medical plan. So like I said, the examples of that would be most people have UHC, although like in Pittsburgh we have UPMC, or out in California there's Kaiser. So that's really the only requirement. Um, as I said, other than that, we would send you a consent form and ask you to really read through it carefully so that you know what you're agreeing to by being part of the program. So that's the only requirement. I do want to mention, because I have seen a few emails now in our inbox around access to the digital pedigree program. I'm going to refer back to the link that Jillian put in the chat through the CDC. That's where you will be able to put in your health information, and generate that information for yourself. What we use is a little bit different. So what we use is not something that you would necessarily be able to access independently. What we use is through a different program, and we can edit it, but it's not necessarily editable for you on the other side all the time. So I think if you're interested, you would need to actually enroll for that part of things. If we're discussing genetic testing, you would need to enroll in the impact program itself. And so if you just want to like have a program for your family history, go through the CDC. If you would like to have a discussion about your family history and have us draw out the pedigree through our program, please enroll, and we can do that. So I'll respond to everybody that's emailed about that in our box, and you can decide. But I just wanted to make that call out as well.
Um, okay, so here someone is asking about genetic testing and whether or not it needs to be repeated. So this individual said that she had genetic, specifically breast cancer testing through a physician in the early 2000s, and should it be repeated due to technological advances? So if either of you want to take that.
This would definitely be a very good example of when to enroll in the impact program, so we can take a look at the results, and take a more detailed family history and get very more specific personal information, and guide you from there. And that goes for anyone on the call who maybe has had genetic testing in the past, or who has family members that have had genetic testing in the past, depending on how long ago it was. We would just really need to see a copy of that report, and discuss what, if there's anything new and additional we might recommend.
Right,
Yeah,
I always,
Yeah,
oh,
go ahead.
go ahead, Jillian.
I was just going to say, my rule of thumb is I tell people to check back in about every 5 years, meaning, not only will the technology change, but their family history may change. And so I think that is kind of the time frame to think about if you're thinking about your own testing.
And I like to point out, in addition to that your genes don't change. It's your family, or I'm sorry, it's the testing technology that changes. So you're born with your genes and they stay your genes for the rest of your life. What changes, though, is the testing technology and the laboratory's ability to perhaps find mutations in genes associated with disease risk that maybe they weren't able to find years ago. So that's why it's a good idea to check back in.
Okay. A question was asked in the chat. Kelly, if you want to take this, what happens with the impact info if you leave Thermo Fisher?
That is a really good question. It depends if we know or not. So we don't always know if you leave Thermo Fisher unless you tell us. And so there is a retention rate, though, on the information that we collect through the impact program. It is a little bit longer than most Thermo Fisher retention rates. We can certainly talk to you about that in more specificity when we discuss privacy when you're considering enrolling. Of course, by request, we can delete all the information, but otherwise there is a retention. But like I said, we don't have access to the information that someone has left the company unless we're notified. So I think another point to make about that is no one else in the company knows that you are part of the impact program unless you specifically allow us to have someone else involved as it relates to maybe some other type of benefit that you need assistance with. And so, we're not connected to any of the departments that, would potentially know about you leaving the company. So we wouldn't know. So like I said, we're kind of bound by a retention rate. So otherwise it would go away after a certain number of years. Or if you tell us you're leaving and would like us to get rid of it, we can certainly do that as well.
Okay. There's a couple more questions here. Here is one that says, I know everyone's case is different, but what type of leave should one be looking at if they're having surgery during cancer treatment?
Is that, Kelly, do you want me to take that? Or you want to
Sure,
take it?
Go ahead. You can chime in and
Why don't you take that, Kelly? Because I think
Okay.
you're more.
So I think you hit the nail on the head by saying everyone's circumstance is different.
Right.
And yes, absolutely. Everyone's circumstance is different. It really depends on the type of surgery that someone's having, their role in the company, the type of job they have, the physical demands of their job, and also what their physician is recommending. So that is a conversation that we can certainly have with you. All of the questions that you can ask your physician and the information that you would need to start planning what type of leave might be best for you or a family member, depending on who you're asking for. But those are the types of things to consider when planning out a leave are, like I said, the type of surgery, the recovery, what the recovery is going to look like, and what your physician is recommending, as well as any financial considerations that you might need to think about when determining leave.
And for those of you who aren't aware, there is a great resource on the Colleague Service Center called the Leave of Absence Journey, which is where you would start if you are taking a medical leave or a family leave that has a lot of the information that that Kelly just mentioned in it. It also has state by state information that you might need before you take a leave. So that's also a place to look to get more information.
All right, here's another question. Is this service available to Canadian employees of Thermo Fisher?
Really good question. Yes, with an asterisk. Yes, so employees and their dependents in Canada and actually the UK as well. Those are the only other two countries besides the United States that can enroll in the Impact program. But I will say not all of our services are available in those two countries. So for example, for someone that's joining us from Canada, we certainly can talk to you about cancer navigation and different benefits from Thermo Fisher that might be available to you, as well as external resources that we're knowledgeable about and can share. Unfortunately, because of our certification and licensure as genetic counselors, we're not able to facilitate genetic testing for anyone in Canada, but we can potentially find places for you to go or people to talk to about that if it's if it seems like it's something that would be beneficial or helpful for you. So yes, you can enroll from Canada, but there are some limitations.
Sorry, I was on mute. I believe we have our last question. If somebody's looking for genetic testing for their family member, maybe not someone that, like for a parent or a brother or sister, not a dependent or spouse, what's a way that they could find a resource in the medical community for getting genetic testing?
We are always,
Okay.
oh, Kelly, do you want to?
Okay, yeah, well, I have two things that I
Okay.
can recommend, and then you can chime in if I miss anything. So, I think the site that Jillian put in earlier from NSGC about the GINA law. NSGC is the National Society of Genetic Counselors. Their general website does have information about finding a genetic counselor. I would say, certainly if you have a trusted physician, family doctor, primary care doctor, you could ask them for information in your location. Otherwise, a number of people do, and we welcome this, a number of people do reach out to us with that exact question. So maybe a family member has a particular condition, they're looking for a genetic counselor. You can always email us what the information we would need to know. We don't need to know who your family member is. So you don't need to tell us. But the only information we would need is maybe the condition that you're looking for genetic testing for. So whether that be cancer or another type of genetic condition, and also the location you're looking at. So zip codes are helpful. Those two pieces of information give us and all that we would need to be able to get you a few recommendations and sites that we can send you to for taking that next step for them to get genetic testing. Or at least meet with a genetic counselor, I should say. At least meet with a genetic counselor.
And that's an important point that Kelly made. If you are, like Kelly said, we very much welcome contact from people who need help with that situation. If you decide on your own to use the NSGC search engine, make sure that you do select the kind of specialty. You can narrow the genetic counselor down by pediatrics or cancer or heart disease, because that'll get you where you need to be and not give you contact information of somebody who maybe doesn't do the type of counseling that your family member needs.
Julie, you actually bring up a really good point. Just to make everybody aware on this call, we're generally talking about family histories and genetic testing, but our service is specifically for cancer genetics. Most genetic counselors subspecialize. So while we might be able to say something intelligent about your family history of heart attacks, that's certainly not our area of specialty. So if your primary interest in your family history is not cancer genetics, you're better off probably going through the general the resources that we discussed for your own testing. All right, I think that is all the questions for today, and I think we've covered everything in the chat. Certainly, if anyone has any additional questions they think of later, feel free to reach out to us at theimpact@thermofisher.com. I did try to put as many of the resources as we discussed in the chat. That includes the Find a Genetic Counselor link. It does include information about leave of absence from the Colleague Service Center. There's a link for GINA from NSGC. There's a link for our personal our site, as well as our email address and a link for the family history software from the CDC. So please, feel free to utilize any of those. Additionally, this was recorded today and it will be posted either Friday or maybe early next week on our Colleague Service Center site. So please just keep an eye out for that there. And I believe that's everything for the day. Julie and Kelly, thank you so much for joining us, and thank you everyone for attending.
Thank you.
Thank you.